All right. So today we'll be going over brain infections, so like infectious diseases. Then we'll be doing personal statement tips, and we'll have some UCAT practice questions as well. And then we'll be going over to one of our well-being officers that will be actually presenting for interview tips. And then we'll start with our well-being section, which will be about mental health. Okay, so we'll start off with infectious brain diseases. So they can be caused by virus, bacteria, fungus, or parasite, so any kind of pathogen. And the infection can involve other parts of the central nervous system, including the spinal cord. There are four main categories of, like, four main examples of infectious brain diseases. And one of them being encephalitis, which is the inflammation of the brain, and um, inflammation of the brain, which is caused by herpes simplex virus or HSV, enteroviruses, and mosquito-borne viruses, and rabies as well. And then we may have meningitis, which is the inflammation of the lining of the brain or spinal cord. So those are known as the meninges. And then another type of infectious brain disease we can have is transverse myelitis, which is the inflammation of a part of the spinal cord. Um, then cerebral abscess is a pocket of pus inside the brain. So that's obviously caused by infection, and like dead white blood cells that collect in one part of the brain, and that causes a pocket of pus. So on the screen, I've got examples of the diseases. So here it's an MRI scan showing a healthy brain, and then here is the swelling. The swelling is quite evident. Um, in a patient that has encephalitis, and then meningitis. So, when I was referring to the meninges, what I was referring to is the pia mater, which is here, then the arachnoid, which is just a layer on top, and then dura mater. And all these three would be inflamed in the case of meningitis, but sometimes also the brain, which can get inflamed in more serious cases. Then we have transverse myelitis, and the symptoms depend on where the inflamed part of the spinal cord is. So maybe if it's at the top of the spine, then the person may have more issues with almost all of their body. And then if it's like more on like below the spine, then it might just be affecting their legs or lower limbs. So transverse myelitis is just like a part of the spinal cord which is inflamed. And then cerebral abscess is the pocket of pus that is situated in any part of the brain, and the symptoms depend on where that pocket of pus is. And then some causes of brain infections include virus. Um, and so some examples being herpes simplex virus, cytomegalovirus, and influenza viruses. Obviously, these are not all the types of viruses that can cause brain infections, but they're just the some that I found. There's some that I found. And then mosquito-borne illnesses such as the West Nile fever and Zika may also lead to brain infections. And then bacteria such as Streptococcus pneumoniae are most common in the US, and fungus such as the Cryptococcus fungi can spread fungal infection into the brain. If there is a fungal infection in any part of your body, it could spread into the brain via the blood. And then parasite, it may like parasitic brain infections may be caused by toxoplasmosis, which is a type of condition, or cysticercosis. And also those with a compromised immune system are more susceptible to a brain infection, because an infection in any other part of the body can easily, like readily, more readily disseminate, meaning it can spread to other parts of the body, especially those that have HIV. They're more vulnerable to invasive fungal infections, and people that have multiple sclerosis they're also susceptible to getting transverse myelitis. Now, doctors and medics, they go on about diagnosing these brain infections by firstly using a brain MRI, which is used to detect an abscess or a lesion, and a brain CT scan, which detects inflammation, and then blood tests, which are used to identify a specific type of bacteria causing the infection. So then, once they know what type of bacteria, is causing that bacterial infection, the physicians can find the most effective antibiotic as treatment for the patient. And then lumbar puncture is also another way that medics can go on about actually diagnosing the patient. And that is where they extract cerebrospinal fluid. Um, as you can see here, it's fluid that is inside the spinal cord. And this fluid can be tested for bacteria, proteins, or increased white blood cells. And so when a lumbar puncture, there are some conditions, some times where a lumbar puncture can't be used, and that is when the individual, the patient is there's already a lot of like brain swelling, and doing a lumbar puncture could worsen the pressure in the brain and can lead to some complications like brain herniation. So they avoid using using lumbar puncture for diagnosis. And then common treatments include antibiotics. This is obviously for brain infections. And so patients are treated with IV antibiotics, that is antibiotics, given through a vein. And this is as soon as a bacterial infection is suspected, because they want to treat the condition as soon as possible because it's involving the brain. And if the brain gets damaged, there are obviously going to be long-lasting physical damages. Then antiviral medications, especially for obviously viral infections and especially for encephalitis, as it's considered quite useful at getting the patient treated. Then another type of medication physicians use is corticosteroids, and this helps lower the inflammation to reduce pressure on the parenchyma. And basically, what the parenchyma is, it's vital brain tissues that hold very, very important functions. So if their inflammation is putting a lot of pressure on the parenchyma, it's not going to be very good, because it will lead to damage in other parts of the body. And it also may reduce swelling and immune system activity, which may prevent sepsis from happening. And some longer term treatments to mitigate the side effects of having, infectious brain disease is psychotherapy, occupational therapy, and physical therapy, because the physical damages that are caused by bacterial infections could be quite, long lasting and detrimental to the patient's health. So physicians try and use these type of therapies to reduce the symptoms and the effects. So we'll delve deeper into the four main categories of brain infectious diseases, one being encephalitis. And so this could be caused by, there are two main categories. There's infectious encephalitis and autoimmune encephalitis. So infectious encephalitis is caused by viral or bacterial infections. And autoimmune encephalitis is caused by immune cells mistakenly attacking the brain. And sometimes the exact reason for autoimmune encephalitis is unknown. Sometimes autoimmune encephalitis can be triggered by cancerous or non-cancerous tumors, and this is known as paraneoplastic syndromes of the nervous system. And other types of autoimmune encephalitis, such as acute disseminated encephalomyelitis, which is also abbreviated as ADEM, can be triggered by an infection somewhere else in the body. And this is known as post-infectious autoimmune encephalitis. And so, in many instances, no trigger for the autoimmune encephalitis is found. So, it can be sometimes like there's no known cause. And then some symptoms in infectious encephalitis include, so like this is like the first initial stages. So there are headaches, fevers, aches in the muscles and joints, and fatigue or weakness. And then as the bacterial infection progresses, the symptoms get more severe. And you'll notice throughout this presentation that a stiff neck is a very distinct symptom for infectious brain diseases. So you would be expecting to be feeling like you have a stiff neck, confusion, agitation, and hallucinations, seizures, loss of feeling, or being unable to move a certain part of the body. So that is regional paralysis. Muscle weakness and lack of control is also another type of um, sorry, my brain just went completely blank. Um, s- uh, and then trouble with speech or hearing and loss of consciousness, including a coma. And then symptoms of autoimmune encephalitis are changes in personality, memory loss, hallucinations, and psychosis, and seizures, changes in vision, sleep problems, muscle infection, muscle weakness, loss of sensation, and bladder or bowel syndromes, depending on how severe the autoimmune encephalitis is. I have a little fact for you here. Between 5% of the 20% of the people that are hospitalized for encephalitis die. So there is a mortality risk for it. And if a baby or an infant gets encephalitis, there are some specific symptoms, including bulging on the soft part of the skull, as you can see in this image, nausea, vomiting, stiffness in the whole body, and irritability. Now, talking about meningitis, that is an infection in the meninges, as I talked about before. It can cause life-threatening sepsis and result in permanent damage to the brain or nerves. And it's usually caused by bacterial or viral infection. Bacterial infection is rarer, but it's much more serious than viral meningitis. And it's most commonly caught by people who are carrying these viruses or bacteria in their nose or throat, but they're not ill themselves. They're not showing the symptoms and they don't have the condition. And those that are treated quickly, they do make full recovery, but sometimes some people can be left with long-term problems such as epilepsy, hearing or vision loss, which can be partial or full, and sometimes even amputations. And so some symptoms of meningitis are flu-like symptoms, a rash, which which I've included a picture of there. It's quite a distinct rash, but sometimes it doesn't develop for some patients. Then a stiff neck, and a dislike of bright lights, and drowsiness or unresponsiveness, and seizures. And so to prevent meningitis from happening, we obviously go on vaccinations. We give vaccinations to newborns, toddlers, and teenagers. So some examples are MenB vaccine, which is given to newborns with a lot more vaccines for meningitis. MMR MMR vaccine, which is given to toddlers, and WV vaccine, which is given to teenagers. And then, so for if you have bacterial meningitis, they will give you IV antibiotics, fluids via vein, and oxygen mask. And viral meningitis tends to get better on its own within 7 to 10 days. Little fact again is 1 in every 10 cases, so that's 10% of all bacterial meningitis cases are fatal. Now, transverse myelitis, it's the inflammation of part of the spinal cord, and the swelling damages the nerves and can leave permanent scars or lesions, and they interrupt communication between nerves in the spinal cord and the rest of the body. So there is no cure, so treatments focus on improving symptoms, and most people recover on their own. Symptoms of transverse myelitis include muscle weakness in the legs and sometimes the arms, mobility problems, unusual sensations and numbness, bladder problems, bowel problems, sexual problems, and pain. So it depends on where that swelling has occurred, where that inflammation has occurred in the part of the spinal cord, and then those symptoms will vary between other individuals. Then some causes are autoimmune disease, viral infection, bacterial infection, cancer, and sometimes there is no cure, and that is called idiopathic transverse myelitis. And so diagnosis is neurological examination, which consists of a mental status assessment. So that's where they assess the cognition of a patient. And then cranial nerve testing, motor and reflex examination, and sensory examination as well. And then we do obviously MRI scans, CT scans, blood scans, and lumbar puncture, which is here. Another fact is that median survival time from the time of diagnosis is 8.9 years, but some people do live up to 16 years. Now, cerebral abscess is pus-filled swelling in the brain, and it occurs when there's bacteria or fungi, and they enter into the brain tissue after an infection, which could be any part of the brain, any part of the body, or a severe head injury. And so the abscess can place pressure on the parenchyma, which could lead to long-lasting effects on the patient. Treatments include antibiotics, antifungal, depending on what caused the infection, what caused the pus, and surgery. Surgery, which is there are two types: simple aspiration, which is where they drain the pus out from a hole that they make in your skull, or a craniotomy where they take the whole skull off and then they, use the brain to get the pus out. So it depends on how big or how small or where the pus is located to dictate what type of surgery they will be using. Now, symptoms include severe headaches, changes in mental state, muscle weakness, slurred speech, paralysis, and fever. And so, seizures are also common, stiff neck, changes in vision if the abscess is putting pressure on the optic nerve, and some causes are obviously infection in any part of the brain, in any part of the body, then trauma, head injury, and sometimes it remains unknown. Diagnosis is blood scans, CT scans, MRI, as I've previously mentioned, and there's also a procedure known as CT guided aspiration, which is where they use a CT scan machine to guide the needle to site the abscess. Now, prevention is vaccination, getting all your vaccinations, such as the MMR vaccine, taking care of basic hygiene and washing hands to prevent any infections in your body, and avoiding contact with patients, which is obviously a no-brainer. And then limit your outdoor activities at night, because that's when mosquitoes are the most active. And then opt for long sleeves and pants to prevent any mosquito bites, and use a and insect repellents. So that is all I have for infectious brain diseases. Now we'll go on to our education officer, and she'll be doing her part on um, personal statements and interviews. Thank you, guys. If you have any questions, put them down in the chat and I'll try and get back to you.
Hey everyone, I'm Helen, the education officer. And so my presentation is on personal statements and some tips for that. So I'll start off by saying that admissions tutors will be reading a lot of personal statements, and it's really important to grab their attention right from the start. And so in terms of like character limits, it's 4,000 characters, which is about two sides of A4 paper. So you need to kind of, I think my teacher said that it's more important to kind of avoid certain things than kind of include them, and you need to know what to include. So you shouldn't overthink like the opening. You need to start by showing your enthusiasm for the subject, kind of showcasing your knowledge and your understanding and like your ambitions, and avoid cliches like when I was younger, I did this. Like, yeah, the opening, it needs to be something that's captivating from the start. Um, Keep it relevant and simple. And yeah, I think this is a nice way to put it. Like, why use 20 words when 10 can make your point? Um, and your work experience and future plans are really important to include as well. So you should share details of jobs, placements, work experience, or voluntary work. And sometimes you might think that some things like for example, with medicine, I was told to complete some work experience at as like a special needs school. And when I tell someone about it, they're like, okay, that doesn't directly lead like link to medicine. But in reality, it really does. That you can talk about that so much in your personal statement, and it does really show a lot. Like for example, in my case, it was I'm able to work with vulnerable groups and people in vulnerable groups. And yeah, I think that can definitely show my passion for medicine. So yeah, anything, a lot of things can link, like even things that you don't think they can. So yeah, and obviously for the 2026 entry, the personal statement has changed for us a lot. So if you are, yeah, trying to enter in 2026. So it'll be composed of three questions, and the three questions will be, why do you want to study this course slash subject? How have your qualifications and studies helped you to prepare for this course or subject? And what else have you done to prepare outside of education? And why are these experiences useful? And I think especially like year 11 and like kind of lower, this part really applies to us. I think we should kind of take these questions and build our answers in this like upcoming year. So if you've not done any work experience, it's not too late. Go do some. Qualifications, I mean, we've all done our GCSEs. I think a lot of us will be doing our A levels. So yeah, that part you don't need to worry about too much. And yeah, and then your like why you want to do it. What is your true ambition? And if we can go to the next slide, I think we've got a couple kind of UCAT mock questions. So if you guys can answer in the chat section, and I'll give, I think, 2 minutes for each question, if that's okay. And then I'll go through the right answer with you guys. So this is the verbal reasoning question. And then we'll have decision making, quantitative reasoning, and the situational judgment section as well. So yeah, I'll give you guys 2 minutes, and please drop your answers into the chat box. All right, and I'll say the right answer in about 20 seconds. So yeah, if you want to drop your answers. So the answer for this section is B, which is false. This is according to ChatGPT, by the way, so I can't like ensure that it's completely correct, but there's a really high chance that it is. So yeah. And if we can go to the next slide, please, Serena. So this is the decision-making question, and like before, I'll give you guys 2 minutes, and yeah, do drop your answers down below. I will be saying the answer in about 30 seconds. So the answer to this question is A. Again, it's according to ChatGPT, but I've been through these questions myself, and A does look like the right answer. Next slide, please, Serena. So the quantitative reasoning question, like before, 2 minutes, and I will be saying the answer in 20 seconds. It looks like a lot of people actually got this one. It is C, 75.7%. Yeah, if we can go to the next slide, please. So yeah, the situational judgment questions. I'll give you guys 2 minutes. I'll be giving the answer in 20 seconds. So the answer to this question is also C, of minor importance. So yeah, those are the questions. And yeah, thank you for listening.
Okay, hi, my name is Silva and I'm in year 13 and I'm going to be going through the interview section today. Okay, so obviously, why am I going through the interview section? So I did go through interviews last year and I did get a couple of offers. So we're just going to go through the different types of interviews and the format and structures. So first things first, there's around two types of main interview structures, a panel and an MMI interview. A panel interview is more impersonal. Is more personal, more than impersonal. You're sitting with two interviewers in a room and you guys are just going back and forth answering their questions. It's kind of what you would assume a normal job interview to be like. But an MMI is what more standard universities are now using, but panel interviews are still used by some universities, for example, Queen Mary's and Oxford universities. Now, an MMI interview can be really different in multiple aspects in terms of which university you're applying for. For example, I applied for one university, I applied for Birmingham, and they have a numeracy station as part of their MMI structure. And I completely flopped that numeracy station. I did not answer like any of the questions because I didn't know any of the answers. My fault for not being prepped. But yeah, so go through different types of MMI stations. But I still managed to get an offer from them because MMIs, they don't really care what you do in one station. It's kind of how you do overall. So you go through each station individually as its own little question and it's marked individually. So let's look at like what the key differences are. So as you can see below, I put some of the key differences, the idea that an MMI is less personal because you're going to move on and you're going to have to restart the whole process over. It's kind of like most of the time it's around 1 hour, but you spend 5 minutes in each station and then you just get moved around. It can vary from university to university. With a panel, you're going to be in that same interview for 30 minutes with those same interviewers. So that can be more personal. It can allow you to develop a rapport that you won't be able to develop in MMI because of the fast moving pace. And you're also more likely to make mistakes in panel interviews. While in MMI, even if you make a mistake in one station, you can kind of get over it and move on to the next station. And I think that can be something that's really hard to do. But once you get used to doing MMI prep, it can get easier. And then one other thing with MMI is you have a lot more do-overs, I'd say, than in a panel interview, because again, you're going to see new people all the time. So we're going to go on to the next slide with different types of questions. So some of the questions you can have are similar to those SJT style questions where it's like, oh, you're a doctor in this scenario, what would you do? Those types of questions. You can also have role play questions. I think one popular one that I've seen is like your cat is you've accidentally ran over someone's cat and you have to break bad news to them. So working on how you can address those different types of scenarios. There's also questions which require a bit of knowledge. For example, there's one popular question that's usually asked about Gillick's competence. So you'd have to know what those types of words mean, Gillick competence, phrases, guidelines, any 4 pillars of medical ethics, just going through those so you can get a good idea of how to answer and approach the questions. And then you also have a bunch of different other questions. There's so many questions to go through. For example, I actually learned a new question yesterday because I had to go to a summer school for unknown reasons. But I learned a new question yesterday, which was kind of like just fill the space. So they asked me a question which was like, oh, Jill has 5 apples. She gave Adam 2 apples, and then had to spend 5 minutes answering this question. But obviously, I didn't know what I was meant to do because I've never approached that question before. But those types of questions you can get. Now, next slide, we're going to look at the 4 pillars of medical ethics. So you have justice, autonomy, non-maleficence, and beneficence. And these are 4 different pillars. They're 4 different pillars that you're going to have to approach how to answer the question and how best to look at it. Justice is something that a lot of people do have to wrap their head around, and it can be really hard to explain. Autonomy, non-maleficence, and beneficence are definitely the ones that you're going to try and want to include in your interview answers if you were approaching them. Non-maleficence is definitely a big one, and beneficence. Beneficence is like working in your patient's best interest. Non-maleficence is causing your patient no harm, and then autonomy is working to make sure your patient's best interests are actually being met, and also making sure that you are just achieving all of those. Then you have extras, which are mostly used in Oxbridge interviews, for example, utilitarianism and consequentialism, which is more focused on how you approach the scenario. For example, consequentialism is actually the idea of focusing on the end goal rather than how you got there. And utilitarianism is more focusing on how you get there rather than the end goal and making sure that that's the reason why you're approaching all of these different scenarios. Now, other things that are useful to include are computer. Other things that are also useful to include are looking at GMC guidelines and looking at GMC guidelines because these can give you really key points that you might want to use. For example, one key point that I used throughout all of my interviews was actually the idea of in the GMC guidelines, it states this, and this is why I want to use this. And also looking at role play examples and working on those. For example, on the GMC website, they have a lot of role play examples that you can actually use and use to begin practicing for interviews that a lot of people don't know about because these are the actual things that doctors use when preparing for the actual jobs and how to approach difficult and complicated scenarios. One of the things looking at keywords and phrases you can use. For example, interviews, there's a lot of if you're doing interviews, there's a lot of different things that you want to try and include. For example, looking at words like again Gillick's guidelines and phrases, all of those things would be key words and things you want to use. In terms of books, you'd also want to read different types of books. For example, one book that's really common is like Do No Harm. Those books can be really important in helping you approach different medical scenarios. The ISC medical school book is one book that is very popular during interview season. It has around 450 plus interview questions. So it has such a different variety and range of interview questions. It has some weird and wacky examples as well as ways you can approach answering the question, which can be something that can be really useful. In terms of if you're doing a role play or anything, you might want to practice with friends and family because they're going to give you an honest opinion on how you're acting and how you are answering questions. For example, during interview season, I actually did a lot of prep with my brother because he would tell me, oh, you're actually not being that serious and you need to approach it differently. And I thought that was something that was really helpful. And then also watching videos and using free guides. For example, I used Jones Healthcare's free interview prep course, which was really useful. I also use a lot of different websites. For example, 6Med had a lot of interview prep. But yeah, let's look at how we're actually going to approach answering some of these questions. So question one. So what are some issues surrounding NHS? I'm actually going to let people put some prompts in for what they think ways you should start approaching how to answer this question should be. But obviously, I've left some on the side of the screen. For example, junior doctor strikes and approaching this by looking at who does this affect and how can we address this. But I'll give it a minute so everyone else can put any ideas they have in the chat. Okay, so I guess no one has any prompts on how to answer that question, but let's move on then. Okay, so question one. Okay, people are putting digesting because of strike, i.e. being into work, and carrying out response like reducing shift times. Okay, those can all be good examples. Okay, let's look at how we'd answer the question. I think one really big thing to do is definitely look at how they want you to answer the question. A lot of medical schools don't have any specific mark scheme. I'll show you an example of one mark scheme that I did find. But a lot of medical schools don't have any specific mark schemes. They're more looking at how you approach and address the question, and actually looking at the fact that you may want to address the question in a specific way. So they're looking at your communication styles. Are you confident giving an answer? They're looking at all of this information rather than, oh, they need this answer, they need this point, they need this, that. No, they're looking at how you approach the question and what you can get from what they're asking you. Yeah, these are all good answers in chat. Definitely using stats can be really important, but it's not the main focus, but that can be a good answer. So what are some key issues surrounding the NHS? Um, for me, I think the first thing I would use the junior doctor strikes because that's something that's recent and something that can be something that you would know about. I would definitely use something that you know about. It doesn't have to be something like the junior doctor strikes. For example, in one of my interviews, when I was doing interview prep, one of the things I actually used the fact that the fact that the black maternity scandal, so that a lot of black women felt underappreciated and not looked after during the pandemic or not looked after when getting maternity care, because that's something that stood out to me as a big issue surrounding the NHS. Also, focusing on doctors and what was actually happening around doctors. Also, remember the NHS isn't just doctors, so actually addressing the whole culture of the NHS as one. But yeah, I think one definitely good way to approach the question is looking at those specific factors and then obviously looking at who does this affect. The issues surrounding the NHS don't just affect doctors, nurses, they're also going to affect the general public. So if we look at the strike, I generally like the answer that Ahmed put in the chat. But if we're looking at the strike, we can use this and then we can actually focus on the fact that another issue is that is causing a lot of distrust with the public. A lot of the public don't feel like they're being looked after by doctors. For example, I actually saw in a newspaper that they described the NHS as horrific NHS. This is giving negative connotations to the word NHS and making a lot of doctors feel unappreciated, making the public feel like they're not being looked after. And this is causing a huge disconnect, which is an issue and then actually looking at why is this an issue? This is an issue because it now means there's a disconnect between doctors and patients and a disconnect between the NHS and patients. And that means that they're not going to come to the NHS if they have issues because they're going to feel like they're going to be ignored. So looking at how we can link everything together. Now, what are issues surrounding NHS? How can we address this? Now, addressing this is looking at what the root cause is. And that can be one thing that you can actually say, actually looking at what the root cause is. Looking at, you can't really put ideas that aren't going to be fixable, but put ideas like looking into what the issues are, actually talking about it. And actually, one other thing that you can say is like informing the public. A lot of the public don't know what's actually going on. Use yourself as an example. For example, when I was in year 11, I actually had no idea why junior doctors were striking, what was going on, until I went on work experience and I actually asked a doctor. So actually talking about yourself and how you found out the answers to these questions can be something that's really useful. Anyway, question number two. Okay, so question number two is one of these questions which you kind of just get thrown in an interview that you may not know how to answer, and you have to just try and give your best way to answer the question. And it's one of those things where you might also have to use some extra information that extra knowledge that you have yourselves. So again, I'm just going to give it a couple of minutes for you guys to put any ideas of how to answer this in the chat, and then we'll go through how to actually answer it. But yeah. I'll give it a couple more seconds and then we'll look at how to answer this question. Yeah. So I guess you could say, yeah, that is only the idea that better healthcare and quality of life, rising population, these are definitely key points to look at. Again, always say take a minute. Like in an interview, they're not expecting you to rush to find the answer. You can actually ask, can I have a couple of seconds just to think through the question and just approach how to answer it. And then you kind of can structure it in your head. A lot of people like to use the STAR technique. So the idea of just using like the structure, the setting, looking at everything that way. So looking at everything that way to identify how you can answer the question. So looking at the situation, the task, the action, the result, and reflecting on experiences on how to answer these questions. But yeah, I think the first thing to do is just understand the question, understand what's actually being asked of you, which most of you have done. One way to also approach this question is actually just explaining what you understand by the question. For example, what life expectancy and longevity actually does mean and what it means to you, and then going into that. So, life expectancy and longevity are rising. What implications of this? So, obviously, using the prompts, why is it rising? So, looking at things like that. What are the main ways you can address this? And polypharmacy and comorbidities. So, the biggest issue with life expectancy and longevity rising is going to be the idea that more people can get sick and that more people are getting sick. Also, one big thing is actually looking at the idea of the aging population. That would definitely be one of our main focuses. Obviously, you can talk about a lot of different areas, for example, as someone did say, economic ideas as well, and everything like that. But our main focus would be the idea of the aging population. So there are, and also like with this last point, that there's a lot of advancements increasing against vaccinations and more infectious diseases. You also have to remember that the rate that these advancements are moving and the rate that we are getting these new diseases is a bit unequivalent right now at this point, even though that is a really good point, it is kind of unequivalent. So we'd kind of more focus on the fact that there are more diseases. So we're going to focus on the idea that because there's an aging population, we're getting more polypharmacy and more comorbidities. So what does this mean? That means that someone who's older, and also one really big thing to remember is that with it's not actually a correlation. So even though you're getting older, doesn't mean there's going to be more disease. It's just something that does happen because you're getting more frail, everything. So for example, if you are older, your bones can be weaker, so you're more frail. You could then, this is obviously a horrible example, this is just an example. Let's say this person that's frail now has a liver problem and they also have I don't know, they also have maybe dementia or something like that. That means you're going to have a lot of morbidities. They're probably taking a lot of medication to help balance all of these things out. So let's say they're now going to the hospital sick. You can't really treat them in a way you treat a standard patient in terms of that you can't really give them the same medications that you give another patient because it could affect something else they're having an issue with. For example, like if they're on like blood thinners and stuff like that, you can't really give them a lot of medication. You have to learn to manage that first. So that means you're using a lot of NHS resources in treating this one person, and you have to give them a lot of medication, which is your polypharmacy, giving them a lot of medication to balance all of these things out, which in terms means that an implication of this is we're using a lot of NHS resources to help manage one patient, and these could be allocated somewhere else. But we again do have to do this because that's what's right and ethical. But also looking at the idea of with life expectancy and longevity rising, also getting this. Obviously, you can then spin it with there's actually a lot of advancements happening that are meaning that we're getting more infectious disease, getting more treatments for these diseases. But then you can also use ideas. I think if you're going to go that route, you need to give an example of one, just in case if it is like a panel interview, they could ask a follow-up question, which is like, what is one of these advancements? I think one of the big ones that I really loved using during interviews was the Q risk 4, which is the idea of it was actually a way to detect heart problems, and actually they began doing secondary and primary preventative measures to help stop things. For example, giving people stents if they had after 5 years still had high risk, they had a 5% chance of getting a cardiovascular disease, they'd start implementing stents. So you're talking about things like that. So focusing on everything and not just one implication. But the main thing that a lot of people, in terms of how to answer these and how to approach the question, be looking at polypharmacy and comorbidities and the idea of with the aging population, there's going to be more issues they're having and how you need to manage this. But all of these are really good examples that you could definitely add on to that answer. So question 3. Okay, so question 3 is one of these standard questions that you are going to get. And I think this is a good question, but I'm going to add a bit onto it. So that how would you handle stress of being a doctor? But usually how they would give you this question is, give me one example when you've been in a stressful situation. rather than how would you handle stress of being a doctor. The question would be give me an example of when you've been in a stressful situation. So let's see how everyone would approach that question. The idea of giving me an example of when you have been in a stressful situation yourself. But yeah, I'll give everyone a minute. Okay, so it's obviously been a minute. Um, so I see a lot of people chose to answer the question on the screen, which is fine. Okay. So in a lot of interviews, they're gonna ask you guys the question rather than write it down. So guys, it's really important that we listen to the question so that we don't mess up the question. But I think one good thing is to actually look at how they would answer you the question. Like I know one of my friends, she went to an interview and she actually answered the wrong question, and they were really understanding and they said that's fine and actually gave her another chance to answer the question. In a normal station, it would be around 5 minutes, 4 minutes. So if you mess up the question, most of the time they will cut you off and give you a chance to re-answer the question, but you would have cut into your time to answer that question. So do take that into account. So guys, the question I asked you was give me an example when you have been in a stressful situation. So that is fine, but let's get into that. So the reason why I asked that question is most of the time they will actually ask you that question first, and then within that question, you would have to relate that to how doctors are also stressed and how this is going to help you be able to answer this as a doctor. I think those are really good things, like a really good questions to practice because you're going to get a lot of these questions. It doesn't have to be stress. It can be a time when you've gotten angry and how you dealt with that, a time when you had to reflect, a time when you were sad and how you dealt with that. Can be so many of these questions, and these questions come up a lot and they come up every single year. So definitely try working on how to answer those questions and how to approach listening to the questions, guys. But yeah, let's get into it. So if we're gonna look at how actually, let me just answer the question in chat. We're going to look at how would you address the stress of your doctor and answer this question on the screen. So all the answers in the chat are fine to say. Actually, I feel like Ahmed, your answer was really good as well. Obviously, everyone you have to work on like extending the answers, but for prompts, these are really good ways to answer your question, to answer these questions. So how would you handle the stress of being a doctor? Now, I think the first thing to do is actually acknowledge the fact that being a doctor is a stressful job. So being a doctor is a stressful job, and ways in which you can handle the stress of a doctor is everything you guys have said could definitely be a way to handle the stress of a doctor. And I think the main thing to do is to say um how would you handle stress of being a doctor is to talk about ways that you know doctors do handle stress. For example, I know that in a lot of hospitals they have things in place for doctors to be able to deal and express their emotions. For example, I know they have short rooms and bubble rooms, which are rooms where they can actually go into to scream, to decompress, and to actually deal with their emotions. So these could be really good things to mention. Another thing to talk about would actually be um how else you could handle stress. Actually, been talking to other colleagues, talking to your colleagues, your multidisciplinary team about anything. A lot of doctors have supervisors they can go to and speak to. So talking to people who understand what you're going through could definitely be a good way. actually taking time back and understanding why you're stressed and dealing with it that way. One of the best things to always say is having a good support system. A lot of people do need that support system. It's really important to understand that and understand that you do need that support system to be able to grow and to be able to do that. So even in difficult situations, you would go to da 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 da. Now, in this question, it's obviously asked, how would you handle the stress of being a doctor? So you have to make it personal. So with Ahmed's question, this is actually a way I would answer this question. So I'm just going to use like similar thing to you. But how I would handle stress of being a doctor is I really enjoy swimming. So one way I would handle being a doctor is when I was really stressed during GCSE season, I used to go swimming because it was a good way to help me decompress and de-stress. So I think as a doctor, I would still probably continue that and continue going to swim because it's a way I really enjoy de-stressing and not being stressed. And on top of that, when I was on work experience, I actually asked a doctor a similar question, and they told me that one way they like to de-stress is by working out. So actually talking about the fact that you've seen a doctor and a doctor's told you a way they de-stress. So obviously, as some of you are in year 11, if you're on work experience, it's definitely a good idea to actually ask doctors a bunch of interview questions because most of the time they will actually answer the questions and give you a good idea of how you can approach questions. For example, a lot of questions here today, I actually did end up asking doctors, and a lot of the times when I was working on how to answer these questions, when I was on work experience, a doctor told me this, and that was a great way to actually back up my point that I was making because I'd had actual real life work experience and times when I'd actually seen doctors and how they dealt with stress. So these could definitely be good things to say. Now, obviously, prompts, how do you currently handle it? Definitely good ways to do it. And then why is this effective? So talking about the way that it means you can be in your best headspace for the patient. It means you can work in your patient's best interest. And on top of that, one other thing that I heard from a doctor is that she said, if I'm not my best self, how can I be my best self for the patient? So using things like that to make it quite emotive and actually make sure that you are understanding everything you're doing is not just for yourself, but also to help the patient. It's one thing I would say in terms of one of the answers is it's really important to look at how you approach the question and what the question is asking you. How would you handle stress as being a doctor? I think when you're talking about yourself, it's fine to mention a lot of different things, but also remember when you're talking about other people and ways that like in general doctors handle it, you want to take a lot of open approaches, not one strict way, and focus on a lot of different things. So focusing on like talking to people, doing this, and what people feel comfortable with, not just your own personal experiences, could definitely be a great way to go into answering those questions. But yeah, next question, looking at the mark scheme. Looking at the mark scheme. So with the mark scheme, in the next slide, yeah. So one of the main things they focus, as I said before, is going to be on your verbal and your non-verbal communication. And actually, in fact, they may have specific phrases that you can say, but it's going to be more open-ended. Actually, having body language, and most of the time they will score out of 5, maybe 10, depending on how many stations. But I think one of the best things to do is actually focus on the fact that interviewers are going to be very tough on you. Some interviews will not smile at you at all. I remember I actually had one really bad interview in which like as soon as the interview finished, I literally started crying because I thought it went so bad. I actually got an offer the next day, which was very embarrassing. But I was literally so upset because one of the interviewers, they were like stone faced the whole time. I made like so many mistakes. I was stumbling over myself. But it's more how you fix those situations and how you move forward from them that's going to teach the interviewer what type of person you are. For example, with that, I would just apologize and I'd keep on going rather than actually just continue to stumble in my words. I'd be like, okay, I'm sorry, I've messed up, and I'll continue going. And actually saying, can I have a minute? And those are great ways to actually address these issues. Another thing is looking at Another thing is looking at how different interviews will. You're gonna get like 3 different types of interviews. There's one interview that's really nice to you alone because you did really well. One of my interviewers, she said after the question, "I've never heard someone take this approach. That was really well done." You're gonna have really strict interviewers, which are strict to everyone, and they're not gonna smile at all. But it's kind of remembering to persevere through that. They want to see how you can face these type of interviewers, and we're gonna have these types of interviews, and these are types of interviews that can annoy everyone. They're gonna smile to you, and they're gonna smile to everyone else in the room, and they're going to tell you did very well, but they're going to tell everyone else you did very well. So you don't know to whether or not to believe them or whether or not to not believe them. But remember, again, it's more of how you approach the situation rather than focusing on, oh, I did well or I did bad. It's more of like you finish the station, move on, forget about it. If you're in a panel interview, you've answered the question, it's done now. Move on to the next question and work on answering that. So yeah, thank you. That is the whole of my presentation.
Okay, Okay, hi everyone. I'm Natasha, the secretary, and I am going to be doing the mental health section of this presentation, this seminar, and specifically we'll be looking at stress management techniques. Next slide, please. Okay, so why talk about stress? Why do we need to be focusing on stress management right now? Well, like we mentioned in the previous interview segment, stress management and stress in general is a major part of interviews. There are a lot of interview questions which are going to be asking you about stress, but outside of interviews in your job and your career, and even during your applications for medicine, you will be facing a lot of stress because applications, Ucat prep, interview prep, all of these processes, procedures can be stressful at times and can also place a lot of pressure upon you. But it doesn't end there. University, your degree, and when you actually start working as a job, doctors might tell you medicine is a high pressure career. There are a lot of emotional situations that you will end up in, a lot of emotional decisions that you will have to make, many life or death situations, life or death decisions that you as a doctor would have to make. Doctors are, again, as we mentioned earlier, required to work long hours with very little sleep, very little time to take a break. And as a result of all of this, doctors end up being very stressed. And it's also one of the most stressful careers out there. Chronic stress can lead to many mental health disorders, including burnout, depression, and like we mentioned earlier, a poor doctor would mean poor patient care as a result, because if the doctor isn't doing well, then who can guarantee that patient care will also be delivered well? So, a stressful doctor can also impact patient care just as much. And if we learn to manage stress now, right when we're applying, it will be very helpful in the long run. It can help us improve our resilience, which is an important skill when it comes to being a doctor. So let us look at how doctors manage stress. Next slide, please. How do doctors manage stress? Now, this is another important part that you can mention in your interviews if they ever ask you about how you would manage stress if you were a doctor. The first point is debriefing with colleagues after a difficult case. So, this is actually very helpful technique to be able to share your experiences with other colleagues, because like many doctors have mentioned, many doctors would have been in situations where they were unable to decide what was best for the patient, or maybe doctors feel like they could have done something better. And they realize when they actually talk to their colleagues or other doctors, there are doctors who've been in worse situations or have dealt with worse. And it helps you feel better as a doctor when you realize that people around you, your colleagues, other fellow doctors have gone through the same situation. So being able to vent out to a fellow doctor, to debrief after a complex case has happened, is a very helpful technique. And boundaries, leaving work at work when possible, is a very important thing, because at the end of the day, being a doctor, doing medicine is just a job. At the end of the day, you're just working. And it's always important that when you're at work, you do work when you're strictly working. When you're outside of work, it's always important to take time for yourself, to do what's best for you, to keep your mental health good, keep your physical health good, and not make your life revolve around medicine, essentially. And that's what follows on to the next point, which is exercising, hobbies, taking time out for yourself, for your families, friends, just doing whatever keeps you healthy, whatever keeps your mind healthy. There are also hotlines, services for both mental health and occupational health. If you're struggling with your physical health or struggling with your mental health as a doctor, you can always reach out, talk to people, go to hotlines, forums. There's many people you can talk to in case you feel like you are struggling. There is also mindfulness or meditation routines, which again help you feel more at peace, help you feel more calm, and as usual, helps you de-stress, helps you feel less stressed out, and thus helps you perform better when you're a doctor, and ultimately improves patient care, which is what we want at the end of the day. And following on to the last point, which is taking your annual leave seriously, taking your leave once a year is very important. It's always important, as we mentioned, not to overwork yourself. Always take time out for yourself, take a break for yourself every year as you should. Spend time with your family, hobbies, activities outside of medicine. This can improve the care you deliver as well as improve your mental state as well. So this is about doctors. We shall now look at how medical students manage stress. Medical students now, of course, there are no patients involved, but lectures, exams, having to study for long hours, late nights, all-nighters, all of these can make you stress, can make you feel pressured upon. So as usual, talking to fellow students, fellow peers who may be in the same situation, same boat as you. So there are lots of online forums that you can go up to, group chats as well, where you can meet students from your university or from other universities. You can talk, vent out, find support from people, share what's troubling you, what you're finding hard, and there will always be someone you can be able to relate to. But at the end of the day, talking to someone always just helps the burden feel less heavier. And planning some downtime between exams and lectures, of course, again, taking break for yourself. Like we went to the next point, which is setting realistic goals. It's always important to realize what's best for yourself, not what's best for others, because um, not every plan fits best for every person. It depends on individual needs, what you prioritize the most. So it's always important to realize what you can accomplish and what you will be able to do. Asking for help again from tutors or student support. There would be a lot of student support facilities at different universities. You can ask help from tutors if you're struggling with your studies, your lectures. But at the end of the day, always reaching out if you ever need help is what matters. And this follows to the last point, which is recognizing it's okay to feel overwhelmed sometimes. It's okay to feel like you're stressed, you're overwhelmed by everything that's happening, but always reaching out, always talking to someone is what helps the most. Next slide, please. Now, what can we start doing now? Most of us in this stage would be in the process of applying or preparing for our applications for medicine. So it's always best to start figuring out which method is best for us now, because different methods work for different individuals. Many of you mentioned in the chat box that you prefer doing journaling. If that works for you, then that would be the best technique for you, or walking, taking leisurely activities maybe, hobbies like art, drawing, painting, meditation, doing yoga, all these mindfulness routines. Different methods work best for different people. You could even specify these in your interviews. And a very important point is learning when to say no. This is actually a point that I myself realized a few weeks ago. It's okay to say no if you realize that you may be overburdened, you may have a lot of things to do at the same time, a lot of commitments, or you may not be able to multitask. So it's always important to learn when to say yes and when to say no. And when you realize that you're at your breaking point, maybe you might not be able to do however many tasks you've been assigned to do. So always be aware of how much you can do. And that leads on to the third point, which is always having self awareness, always being aware of what's out of your limits, what's within your limits, what you can do, what's within your capabilities of doing. So it's always important to realize how much you can manage as a person, because most of the time, talking to different people, you may feel like one person can do more than you, one person doesn't do as well as you, but at the end of the day, it's your individual needs that matters. Just like we said for doctors, get good sleep, exercise, find your hobbies, find your niche, which activities work best for you. Find friends, social connections, network with people who may be the same boat as you, and it's always important that those connections are healthy as well. And just like basically a summary of everything we said, don't glamorize overwork. There are lots of doctors who even tend to brag about how many hours they've worked, how many shifts they've worked. But at the end of the day, if you're feeling overwhelmed, it's always important to share. It's not about how many hours you work, it's about how you're doing, your mental health and your physical health. So always ensure you have a sustainable work ethic. So that's all from our segment. Thank you.
All right, thank you for everyone that presented and stayed to listen. I'll be sending in the attendance form. Please make sure to fill it out. And if you have any more questions, we'll stay behind. And yeah.